You are caring for a patient who is started on clindamycin, ketorolac, prednisone, lisinopril, and simvastatin. After receiving multiple doses of each of these medications, you notice that the patient's blood glucose is 205 mg per deciliter. Which of these medications is known to cause hyperglycemia? A. Ketorolac. B. Lisinopril. C. Simvastatin. D. Prednisone. E. Clindamycin. The answer is D. Prednisone. Of all the medications listed, prednisone is the only medication that is known to cause hyperglycemia. Prednisone has a number of side effects including hyperglycemia, acne, headache, restlessness, insomnia, nausea, vomiting, and weight gain, among others. Clindamycin's side effects include diarrhea, including Clostridium difficile, and less commonly nausea, vomiting, and abdominal pain, among others, but not hyperglycemia. Ketorolac's side effects include renal toxicity, tinnitus, heartburn, diarrhea, and abdominal pain, among others, but not hyperglycemia. Lisinopril's side effects include hypotension, lightheadedness, angioedema, and barky cough, among others, but not hyperglycemia. Simvastatin's side effects include muscle pains, aches, muscle weakness, and less frequently confusion, and electrolyte disturbances, but not hyperglycemia. You are the nurse taking care of a patient with type 2 diabetes mellitus. The patient is hospitalized for pneumonia and switched from his home medication, metformin, to sliding scale insulin, while inpatient. You explain to the patient that the specific reason is which of the following? A. To prevent lactic acidosis while hospitalized. B. To prevent headache while hospitalized. C. To prevent myocardial infarction while hospitalized. D. To prevent depression while hospitalized. E. To prevent stroke while hospitalized. The answer is A. To prevent lactic acidosis while hospitalized. A known side effect of metformin use is development of lactic acidosis, a form of metabolic acidosis. Patients who are hospitalized, especially if hospitalized for infections, like pneumonia, are independently at an elevated risk of developing a lactic acidosis. As such, to minimize the risk of lactic acidosis, a modifiable risk factor, metformin use, is frequently temporarily discontinued while inpatient. Patients on metformin are frequently switched to sliding scale insulin as inpatients, as this allows for adequate glycemic monitoring, titration, and control. Once they are stable for discharge and the cause of their hospitalization is addressed and treated, most can be safely discharged home on metformin without issue. While numerous measures are carried out while patients are hospitalized to prevent myocardial infarction, stroke, headache, and depression, the switching of metformin to sliding scale insulin is not performed specifically for any of those reasons. Which of the following is true of type 1 diabetes? A. Patients develop insulin resistance. B. Patients are typically overweight adults. C. Patients typically present in diabetic ketoacidosis. D. Patients do not require treatment with insulin. The answer is C. Patients typically present in diabetic ketoacidosis. Type 1 diabetes is an autoimmune process that typically presents in young children in the form of DKA, diabetic ketoacidosis. This potentially life-threatening condition is treated with IV insulin. Type 2 diabetes is insulin resistance, and is found in older adults, typically those who are overweight. The nurse is caring for a patient who is to receive a fasting blood glucose test. The nurse does all of the following to prepare the patient except dash. A. Restricts meals 4 to 8 hours before the test. B. Marks the patient in PO 2 hours before the test. C. Instructs the patient to refrain from the use of hard candy. D. Instructs the patient not to use any gum or breath mints. E. Stops the patient's D50.45 IV maintenance fluid. The answer is B. Marks the patient in PO 2 hours before the test. The patient should refrain from ingesting any material that may contain sugar prior to a fasting blood glucose. However, is not necessary for a patient to be labeled in PO as they are still able to ingest water. All other preparations should be made. The nurse cares for a patient newly diagnosed with systemic lupus erythematosus, SLE. Which of the following is a characteristic sign of SLE? A. Pain during exposure to cold. B. Blood in urine. C. Arthritis and joint swelling. D. Lesions on extremities. E. Butterfly rash across bridge of nose and cheeks. The answer is E. Butterfly rash across bridge of nose and cheeks. The most characteristic sign of SLE is a butterfly rash across the bridge of nose and cheeks. The others listed are also signs and symptoms of SLE, but the most well-known sign that is specific to SLE is the butterfly rash. Arthritis and joint swelling, hematuria, lesions on extremities, and pain during exposure to cold, Raynaud's phenomenon, may be signs of other diseases.